What is up, everyone? Please take a second to hit that like button. The more likes that we get in a short period of time, the more people the algorithm will bring into the chat to come hang out with us and see what's going on. So please hit that like button. How are all of you on this afternoon / morning, depending on where you are in the world? Please let me know in the chat. And thank you so much, Azorbian, for your donation and your support. I really appreciate you being here. So, old man Walter Biden, he is an hour and 28 minutes to his own speech on what's happening in Afghanistan. I'm late as well, but that's okay because we're right on time. I actually just got some pretty crazy news from a friend of mine. My friend told me about our mutual friend where his wife works in a medical facility that's near us. I don't want to say where it is, but it's a hospital, a big one. There are currently being random meetings happening all day with DHS talking about training on next week. They're going to start removing kids from homes where they are not getting the jab. That's obviously a very big deal. That's a line that we can't let them cross. Go ahead and look into it. This is here in Michigan. DHS is a big deal here in Michigan. I mean, CPS will come to your house for anything and everything. So definitely look into it for your state. Talk to your friends that work in medical fields who hasn't left already because of their own mandates. Another friend of mine who still works at the factory I was working at, which I haven't ever really disclosed it, but I don't work there anymore because of what I do here. I was let go, but they're about to be mandated because of the FDA approval. So yeah, they're getting ready to be mandated probably in a week or so, and DHS is collaborating with hospitals to figure out who is and who is not received the jab. And they're talking about starting next week, they're going to start pulling kids out of houses. Don't take my word for it. Go look into it. I wouldn't tell you if I didn't think it was true. I haven't had enough time to look into it. I've only known for like 10 minutes. I just posted it in the Discord. So if you're a part of the Discord, you probably have already seen this. I have the screenshot from my buddy telling me. My friend is very close to me. He knows that I will get this information out there. He wouldn't have told me if he didn't, have good information. So definitely look into it. It's a big deal. It's a big deal. This may be that line. It may be time. So I wanted to make sure that you guys were aware of all of that. I take it very seriously. I assume all of you take it very seriously. It's we're not going to let them cross that line. So I just wanted to update you guys on that. And like I said, we're waiting for old man Walter to get on the screen. He's probably getting his injections. He's probably getting a good wiping down or a wiping up. And if you give me a moment, I got to send out these notifications so we can fill the chat. While I'm doing that, please hit the like button. And please share this stream out so we can get the truth out to more viewers. Thank you guys for being here. Hey, thank you so much, Mercury Girl. I really appreciate the donation and the support. Hey, thank you so much, Paul. I really appreciate your donation and your support. Thank you for being here. Oh, also today is the day where I was planning on having a march, a flag waving march. It is being pushed back. It was gonna be after 2 o'clock Eastern time. My friend does not get out of work on time now. They're working overtime. So when he gets out, I do still plan on doing a march. It's probably gonna be just me and him, but it doesn't matter to me. I got to get out there and let my voice be heard. I'm sure people will see it and join us. Maybe not today, but maybe they'll join us for the next one. I could really care less. I'm going out there to wave the flag and show everyone that I love my country, and that's all there is to it. I'm not sure when it's going to happen. It might be after 4 o'clock. It might be after 6 o'clock. I'm not really sure. I do intend on doing a practice live because I've never gone live from my phone before. I bought a microphone to attach to my phone, so hopefully we will have decent audio. You won't be hearing like the wind blowing and stuff. Trying to think. I was going to do a live yesterday, practice live from my phone to be prepared for today. And it seems like every time I say something bad about the government on the live, my phone doesn't work anymore. I left the house yesterday. I had to run to Walmart and get some more canned food and stuff for potential life in the future. Nothing. No signal, no data, no nothing. And I had this problem a lot during what happened in January, where we were going live every day and we were keeping an eye on court cases and irregularities and stuff like that. And pretty much on a nightly basis, I had something to say about the government. And it seemed like every time I did, all of a sudden my phone didn't function anymore. And it happened all the time. It was like 4 or 5 times where I would just lose signal. I would lose data. It would no longer function. I would call the phone company and tell them, and they would say, well, it's not on our end. Everything looks fine on our end. Buy a new phone. Buy a new SIM card. Start a new plan. Even though you've been running the same plan for 12 years, start over on a brand new phone, a phone I had only had 6 months. After 3 or 4 times, I ended up dropping the company and going with a new company, and it's been fine ever since. Well, then yesterday I said what I said about the government, and all of a sudden my phone doesn't work again. It's dumb. It's dumb. I don't really like to talk about that because people always give me a lot of Q crap. I'm not saying it because of Q crap. I'm saying it because it is a super inconvenience and very coincidental at the same damn time. Very irritating when you need your phone and your phone doesn't work. So yeah, that's why I didn't go live yesterday for a practice in-person live streaming. But I do plan on doing that today, probably in a couple hours, depending on how this all goes. Like I said, old man Walter, he was supposed to speak at noon. It's now 1:36. At 2 o'clock, we're supposed to have a press briefing with the C19 team and public health officials, which is usually the false Jeff and all those idiots like Fauci and all of them on the screen lying to our face. And then at 2:45, we're supposed to have the press briefing with Jen Balsacki. I don't know what we're going to see. I don't know what's going to pop on the screen. This is now the 3rd time. Old man Walter has been an hour or more late. The very first time it happened, he didn't even go live. They just went straight to the press briefing. So I don't know what we're about to see. Knowing the way this White House schedule works, they might make a liar out of me, or at least out of my title. We're going to see what happens next. What's up, William? What's up, XRP? Yeah, I agree with you. Hey, thank you so much, Mercury Grill. I really appreciate all your support. I don't even know what your name is. It'd make my furniture start levitating. Guess what? You can't speak anymore, you dumbass. I hate when people try and get on me about unbiased reporting. It's really difficult when you know as much as I do. When you've seen as much as we've all seen, it's not that it's hard to be unbiased. My stuff clearly says that I love the Constitution and my country. If you come against the Constitution or the country, I'm against that. I don't understand how that's so hard to like fathom. Like, your brain don't function when you say stuff like that to me, you idiot. You not see my shirt? You don't see the tapestry behind me? Anybody who goes against that stuff, I'm against you. Period. That doesn't make me biased news. It should make you upset too, you idiots. Like, if you live here, that makes you an idiot if you support that. If you support Antifa, if you support Old Man Walter, if you support these mandates, if you support gun grabs, if you support anything like that, the censorship or any of it, then you're un-American, you're a communist, and your kids deserve to be cop. That's it. That's it. That's how I feel about it. So don't be on my live talking to me, because we'll go in on your ass, dumbasses. We're America around here, motherfucker. Oh yeah, and I want to give an apology to everyone that was watching on Odyssey yesterday, and I was saying I can't see your comments. I had a human error. I was watching an old live on Odyssey. I had it pulled up, so I couldn't see any of you guys' comments because I wasn't even watching the right live. So if you were watching on Odyssey yesterday and you were trying to scream my name like, hey, I'm right here commenting and you can't see me, that's because I'm an idiot. My bad. I'm sorry. I will do better this time. All right. Well, I'll put the big blue screen up, so whenever they do decide to put something up, we will all catch a first glimpse together. So just a moment. Sitting here going through the chats, seeing what everybody's writing and whatnot. Again, I have 5 chats going, so pardon me if I don't see your comment. Again, tag me if you really want me to see what you're saying. Tag my name. You have to write at and spell it exactly how it's written wherever you are watching it. It should highlight it for me, and it will make it easier for me to see that you're talking to me. Yes, Cindy. I was running a little rough yesterday. Yesterday was a Monday for sure. So yeah, messed up for Odyssey. But big shout out to everyone that watches on Odyssey. Everyone on alternative platforms, your help spread the word, because like, we're only on YouTube because that's where everyone is. It's the biggest streaming platform in the world. That's the only reason we're there. If I could reach just as many viewers away from YouTube, I wouldn't be on YouTube, because the censorship is crazy. When I first started streaming, you could watch anything. I could put anything on the screen. Anything that was like above dark web stuff, I could put it on the screen. We were watching people go into shell shock, 20-year-olds getting flashbang and just freezing up, just not even being able to handle what's around them. It was hard to even watch. People were like watching and crying and stuff because it was so hard to watch when all of this stuff started. And now I can't show half the stuff. I got this black box flying all across the screen trying to cover up paintball guns and stuff. It's so stupid, but these are the hoops I have to jump through to get the truth out there. Awesome, Mr. Bill. I will do my best to cover you. If I'm not at the flag march, either before or after it, and you go live, I will definitely cover you. Oh, another thing is I up the buffer rate a little bit, so I don't know if that's gonna mess with Odyssey in a negative way, but everyone else should be seeing a clearer feed today than you have in the last week or two. Yeah, I appreciate you, PMT. So it looks like they just cut off Old Man Walter's speech on the White House schedule. It now says at 1:45, which is in 1 minute. They will just go straight to the press briefing for C19 and public health officials. And I just said that was going to happen. They're going to make my titles a liar. I'm going to do my best to try and switch the titles over, but you guys might need to help me out when new people get in the chat and they're like, what the hell is this? This isn't what we're supposed to be watching. But give me a second. I have to switch to live stream because I don't think it's going to pop up on this specific live. I'm going to have to switch it out. So just a moment. I keep seeing people saying the FDA did not approve the jab. Well, whatever they did do, it makes people feel like they can do the mandates because they are already starting to enforce it. At least here in Michigan, they're already talking about it. That you will be put in a position. The factory workers are all being threatened with it right now. Oh, Death Striker Zed. Wasn't sure what you were saying at first, but now I see what you mean. Nah, Old Man Walter isn't going to turn me into a liar. They're turning my titles into lies. I don't think I'll ever be a liar. It's too fun to tell the truth. You tell the truth, it just flies right out of your mouth because you don't have to think about it. You don't have to manipulate it. It's not really using the creative part of your brain. You just know it and you say it. And then people get mad. A lot of people get mad. They cry real hard. It's mildly entertaining because it's just full-blown mental disorder, but they're delusional about it. So just stay with me and keep telling the truth. It's worth it.
After I provide a brief update, we have made remarkable progress on vaccinations in just 7 months, with more than 200 million Americans now with at least their first shot and 171 million Americans fully vaccinated. But we can't and we won't let up. We're now in a pandemic of the unvaccinated, and the way to end this pandemic is more vaccinations. More vaccinations, that's exactly what we're getting done. Nationwide, we've gotten a total of 6 million shots in arms in the last 7 days. That's the highest 7-day total in over a month and a half. And at the end of last week, for 3 straight days, we got more than 1 million shots in arms each day. That's the first time that's happened since June. Importantly, we've dramatically increased the number of people getting their first shots each day. Back in mid-July, we were averaging 260,000 first shots in arms per day. Today, we're getting 450,000 first shots a day, more than a 70% increase. And we're seeing the greatest increases in states that had been lagging on vaccinations. In Alabama, Arkansas, Louisiana, and Mississippi, more people got their first shots in the past month than in the prior 2 months combined. This is critical progress. In the face of the Delta variant, more and more Americans are stepping up each day to get vaccinated. We're working to encourage more vaccination, including through vaccination requirements. Over the past several weeks, we've adopted vaccination requirements for federal workers, the armed forces, and healthcare personnel at both the Department of Veterans Affairs and the Department of Health and Human Services. And just last week, the President announced that nursing homes serving residents covered by Medicare and Medicaid will be required to have vaccinated staff. Yesterday, after a thorough, independent, and rigorous scientific review process, the FDA gave full and final approval to the Pfizer vaccine, reaffirming its findings that the vaccine is safe and effective. As Dr. Murthy will discuss, this is a key milestone that will help get more shots in arms. We know that there are Americans who have been waiting for the FDA process to be completed before getting a shot. For those Americans, the wait is over. Now is the time to join the more than 200 million Americans who have already rolled up their sleeve and gotten vaccinated. It's free, it's easy, and it's never been more important to protect yourself, your loved ones, and your community. It's not just individuals. Institutions must step up too, and many are. In just the past 24 hours, CVS, Chevron, Texas Instruments, Ochsner, that's a health system that's one of the largest employers in Louisiana. All of them have stepped up to cover their workers. New Jersey and New York City have stepped up to cover teachers and school staff. And the University of Minnesota, Centre College, and State University of New York have stepped up to cover students. We expect more and more to follow. If you're a business, a nonprofit, a state or local leader who's been waiting for full and final FDA approval before you put vaccination requirements in place, now is the time. You have the power to protect your communities and help end the pandemic through vaccination requirements. Let me be very clear. Our wartime response will continue to deploy every tool at our disposal to get more people vaccinated. Just today,
Did you hear that?
HHS announced that it's changing its reimbursement policies so pharmacies and other vaccination providers have additional support and incentives to administer vaccines in smaller long-term care settings. This will help ensure long-term care residents have greater access to COVID-19 vaccines. At the same time that we drive more progress on vaccinations, our COVID-19 surge response teams continue to work with states to respond to Delta outbreaks. We are working with 17 states and have deployed over 700 federal personnel, surged hundreds of ventilators, ambulances, and other critical assets to support hospital systems, and established dozens of free testing sites. Importantly, since July 1st, we've shipped over 500,000 life-saving therapeutics to treat COVID-19 patients. 500,000 therapeutics that are preventing hospitalizations and saving lives. We continue to accelerate the use of these treatments. In fact, in just the first 2 weeks of August, we shipped more than 10 times the amount of treatments we shipped to states in the entire month of June. We are acting aggressively to stay ahead of the virus and are planning for booster shots starting the week of September 20th, pending FDA and ACIP approval. We expect the rule will be simple. get your booster shot 8 months after you got your second shot. We're working closely with states, pharmacies, and others who will get the job done at the local level. Earlier today, we convened 2 important meetings, one with governors and their teams, and one with pharmacy CEOs to discuss their operational planning so they're ready to hit the ground running. Our message is clear. We will mobilize the unprecedented level of federal support we have provided states, pharmacies, and other partners since the president took office, and help in any way that we can to get booster shots in arms. I'll end with this. The president's whole of government effort continues full speed ahead across all fronts to defeat this virus. And as we have said from the start, we need everyone, governors, leaders of educational and healthcare institutions, employers, small and large businesses, and all Americans to do their part to defeat this virus. With that, let me turn it over to Dr. Walensky.
Good afternoon. Let's begin with an overview of the data. Last Friday, CDC reported 157,000 new cases of COVID-19. Our 7-day average is about 137,000 cases per day. This represents an increase of nearly 12% from the prior 7-day average. The 7-day average of hospital admissions is about 11,000 per day, similar to the previous 7-day period. And 7-day average of daily deaths have also increased to 739 per day, an increase of 23% from the previous 7-day period. As cases, hospitalizations, and deaths continue to rise, I want to re-emphasize the serious risk of COVID, especially to the unvaccinated, and the importance of vaccines to prevent severe illness and save lives. This slide shows data on hospitalizations among the vaccinated and unvaccinated reported to CDC's COVIDNet. This is a nationally representative sample of hospitals that covers approximately 10% of the US population. Based on these data, from January through July, represented on the horizontal axis, COVID-19 associated hospitalization rates were 17 times higher in unvaccinated, shown by the blue line, compared to vaccinated adults, shown by the green line. These data have been submitted to a preprint server and anticipate they will be posted online in the next few days. Additionally, today in CDC's MMWR, we published a report examining data from Los Angeles County between May and July, which found that people who were unvaccinated were nearly 5 times more likely to be infected and about 29 times more likely to be hospitalized with COVID compared with people.
What's 29 times 0.03?
These data remind us that if you are not yet vaccinated, you are among those highest at risk. The Delta variant of SARS-CoV-2 virus is highly transmissible, represents over 98% of COVID cases here in the United States, and is driving up infections, hospitalizations, and deaths across the country. Please do not underestimate the risk of serious consequences of this virus. Vaccines are the best tool we have to take charge of this pandemic. We continue to see more and more data on the safety and effectiveness of the vaccines authorized in the United States, and now we have full FDA approval for one vaccine and extraordinary safety and effectiveness data for the others. If you are unvaccinated and ready to revisit your decision to get vaccinated, or if you still have questions, talk to your physician or a trusted source to get the information you need to get vaccinated. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. I'd like to spend the next couple of minutes in addressing a much underutilized intervention for COVID-19, and that is the use of monoclonal antibodies for the treatment and prevention of SARS-CoV-2 infection and COVID-19 disease. Next slide. For those not totally familiar with this, monoclonal antibody is an antibody that's produced by a single clone of B cells or a cell line and consists of identical antibody molecules that can actually be produced in the in vitro situation in unlimited quantities. Next slide. If you look at the virion on the upper left part of the slide and you look up the blown up spike protein, the red molecule on the right upper panel. When you talk about polyclonal antibodies, which result from infection or vaccination, it's a group of antibodies against every aspect of the spike protein, which is the good news. However, the concentration and the affinity of those antibodies can be markedly improved if you get a single cloned antibody, hence the word monoclonal, that's against a very specific part of the spike protein that can have a major effect in prevention and treatment. Next slide. So let's look at what we have. We have 3 anti-SARS-CoV-2 monoclonal antibody products that have currently had emergency use authorization from the FDA. And the EUAs here are for adults and children 12 years of age and older who weigh at least 88 pounds. There are 3 of them. There's the Lilly product, the bamlanivimab plus etesevimab. There's the Regeneron product referred to as RegenCov. And then there's the GSK and Vir product. Each of these products targets the spike protein of SARS-CoV-2. Next slide. So
he said project like a psyop.
These antibodies that are twofold. The first is to treat infection with SARS-CoV-2. Next slide. And in this regard, clinical trials have demonstrated that early treatment with anti-SARS-CoV-2 monoclonal antibodies can reduce the risk of COVID-19 hospitalization or death by 70 to 85%. It is important to emphasize that this must be done early in infection and not wait, of course, until a person is sick enough to be hospitalized. That's when you get the best effect. And again, being an underutilized intervention, we want people out there, including physicians as well as potential patients, to realize the advantage of this very effective way of treating early infection. Next slide. Now, if you look at the people who should benefit from this, this is a list from the FDA and the NIH treatment guidelines about all of the people who may have significant benefit from this type of therapy if given early in their infection. I'm not going to go through each and every one of them, but as you can see, there are a number of conditions on this slide that could benefit from the monoclonal antibody treatment after infection. Next slide. But there's also the benefit of prevention using monoclonal antibodies. Next slide. And we know now that the FDA, just a couple of weeks ago, authorized the Regeneron monoclonal antibody for post-exposure prophylaxis, namely for the prevention of COVID-19 after someone has been exposed to a documented case of SARS-CoV-2. And even now, and I won't show the data because of lack of time, there are now studies in pre-exposure prophylaxis as well as other studies in treatment. So I'll have on the last slide, next slide, the treatment guidelines panel. We can give you all the information and it's accessible on the website shown here. And for physicians, patients, and others who want to know how you can get monoclonal antibodies administered, this is the call center, and this is the online way to approach it. So, bottom line is, this is a very effective intervention for COVID-19. It is underutilized, and we recommend strongly that we utilize this to its fullest. Back now to Vivek Murthy, Dr. Murthy.
Well, thanks, Dr. Fauci, and it's really good to be with all of you again virtually today. Yesterday's FDA approval of the Pfizer COVID-19 vaccine is a new milestone for our country's vaccination efforts. We know that some people have been waiting for this next step to be complete before they choose to get vaccinated. And if that's you, the time to get vaccinated is now. I want to talk about what approval will mean for 3 major groups that have played a key role in getting people vaccinated to date. First, the approval will help doctors and nurses instill even more confidence in the vaccine among their patients. More and more, clinicians are talking to their patients about vaccination, recognizing that they are among the most powerful voices and help people understand the life-saving benefits of the vaccines. They're also administering the vaccines in their clinics and hospitals. According to one estimate, the number of primary care practices which administer vaccinations in their offices jumped from less than 40% in April to over 75% in mid-July, which means that it's a lot easier now for patients to get vaccinated during routine visits. In addition, 4 of the country's largest health systems, representing 315 hospitals and more than 30 million annual patient encounters, have just committed to making vaccination more convenient by vaccinating in primary care offices, hospital discharge points, and emergency departments. And an additional 29 healthcare networks have committed to proactively reach out to their unvaccinated patients to make vaccines available at more primary care offices and to arrange transportation to vaccination sites. Second, the approval will also support employers and educators in their efforts to vaccinate their workers and students. As our kids and young people return to the classroom, we know that many schools and universities and businesses have established vaccination requirements in order to create safer places for people to work and to learn. Yesterday's approval by the FDA will help nudge organizations who may have been on the fence about vaccine requirements to move forward with such plans. It will give these institutions one more reason for their students and employees to get vaccinated. They'll be able to tell them that the FDA approval represents the gold standard for vaccine safety and effectiveness. And they'll be able to tell them the FDA didn't cut any corners to approve the COVID-19 vaccine. What they did do is work around the clock, reviewing hundreds of thousands of pages of data and inspecting the facilities where the vaccines are produced. After all that, the Pfizer vaccine passed the FDA's rigorous review, yet another reason to feel confident that getting vaccinated is the right thing to do. And third, the approval will embolden and equip our COVID-19 community corps with even more tools to talk to their communities about vaccination. Since the spring, we've been building this people-powered movement of individuals and organizations across the nation based on our belief that health information is best when it comes from local trusted sources. The thousands of conversations that our community corps members have had in recent months has led more people to get vaccinated, and those conversations have saved lives. Now they have yet another tool to help people understand the safety and effectiveness of the vaccines. You know, at the end of the day, the reason we are making progress in increasing vaccination rates is because in the face of the Delta variant, everyday Americans are doing their part to talk with each other about getting vaccinated. We're making progress because so many doctors and nurses and other health professionals are taking time to have these conversations with their patients, even while they work around the clock to care for the thousands of people hospitalized with COVID-19. So if you are not vaccinated, the FDA announcement gives you one more reason to get vaccinated. Please do it. Please get vaccinated. Do it for your own health. Do it for our children who aren't able to get vaccinated and rely on the rest of us to shield them from infection. Do it for our healthcare workers who are running on fumes as they struggle to care for COVID-19 patients in overflowing hospitals for the 4th time during this pandemic. And do it for your community, which needs more people like you to get vaccinated in order to return to normal.
Nah, they're safe from us, remember?
This is the time for you to talk to your family and your friends and urge them to get vaccinated. The Delta variant continues to spread, and everything we have learned until now has told us that the vaccines are the best way to save lives and keep people out of the hospital. Thanks for your time. I'll pass it back to Jeff.
Thank you, doctors. Let's open it up for a few questions. Kevin?
First question, let's go to Kristen Seamus at the Detroit Free Press.
Thanks so much for taking my question. I wanted to ask a little bit about the CDC recommendation for masking in K-12 schools. Many school districts have opted not to require them despite that recommendation. And given that COVID-19 case rates, hospitalizations among children are climbing, is it now time for the federal government to ask governors to put in place statewide mask mandates for K-12 schools, especially given that kids at the elementary level, where they're not yet eligible for vaccines? And if not, why not?
Dr. Walensky, do you want to go first, sir?
Yeah, I will just say It's critically important that we get our children back to school. We have seen over the last year and a half now the implications of not having our children in-person learning. We know that most of the disease that comes into the schools comes in from communities, and we have high rates of the communities now. So we want to decrease the rates of disease in communities by surrounding children with people who are vaccinated. And then, of course, to following our prevention guidance for schools, which we have provided, layered mitigation strategies, including masking, as well as cohorting, ventilation, and distancing and screening to keep our children safe in the school environment.
Yeah, just to add a little bit to what Dr. Walensky said, the president's message to those educators who are stepping up right now to protect their students when their governor will not is clear, and that is that we stand with you and are ready to support you in any way. As Dr. Walensky said, the bottom line is we know what works. The vaccines work, masking works, prevention and mitigation strategies work, and there's plenty of funding that's been made available thanks to the American Rescue Plan. Unfortunately, some school districts are being forced with difficult choices, defy their governors or hurt their students. No school should have to make that choice. Governors and other leaders must put politics and their own political self-interests aside. The president has directed Secretary Cardona to look at everything that can possibly be done to protect students and help local leaders do the right things to keep kids safe and in school. And one of the options that the secretary has laid out is out of his Office of Civil Rights Investigations. So we'll continue to use every tool available to support efforts to protect students and bring them back to school safely. Next question. Kevin?
Hi, can you hear me?
Yeah. Yes, we can.
Great. Can you talk about, I just came out with a story yesterday about the problems that pregnant people in the U.S. are facing. Only 76% of pregnant people in the U.S. are unvaccinated, and we are seeing rises in pregnant people who are ended up hospitalized with COVID-19. What are you going to do to try and get more pregnant people to get vaccinated, especially in light of the CDC's recommendation to do so a few weeks ago?
So Dr. Walensky, why don't you review that recommendation, and Dr. Murthy, you can talk about efforts to get the word out.
Great, thank you. So last week, we reiterated and strengthened our guidance for pregnant people to get vaccinated. We have data on CDC website talking about pregnant women who have gotten vaccinated during pregnancy. However, there are a lot of more vaccinated people who were vaccinated prior to their pregnancy. We do know that SARS-CoV-2 COVID leads to increased severity of outcomes in pregnant women and increased severity of outcomes in their unborn babies. And so we are advocating, suggesting, highly recommending, as is the American College of OBGYN, to vaccinate people before pregnancy or during pregnancy.
Thanks, Dr. Walensky. And what I would also say is we believe this issue is so important that we have mobilized a number of assets to help get the information out. We've been working with the medical community, with the American College of Obstetricians and Gynecologists, with family medicine doctors and other primary care providers to make sure that they are talking to their patients. We're also doing sessions where we're talking directly to communities, hosting community town halls. And we're also working with our trusted messengers to make sure folks are talking to people in communities, whether that's in churches or synagogues or other settings, to get this information out. What people also, it's so important that they understand is that the risks of getting COVID during pregnancy are significant. There's a significant increased risk of hospitalization, of ICU stay, of preterm labor and preterm birth. These are not insignificant risks. And the best way to reduce your risk, to take care of yourself during pregnancy, is to get vaccinated. That's why we're working hard to get that message out.
Let's see.
Next question.
Go to Sasha Pesnick at ABC News.
Hey guys, thank you for taking my question. It's a two-part one. The first is for Dr. Fauci. You've given the timeline that Americans could see the light at the end of the tunnel in the pandemic by the spring of 2022. And to get there, a lot more eligible unvaccinated people will have to step up for their shot. But What happens if after this full approval of Pfizer, we still don't see the vaccination numbers budge significantly? So what's the administration's plan at that point to get us where we need to be? And that leads me to part two for Jeff Zients. The vaccine's full licensure may pave the way for further vaccine mandates. Is the administration prepared to go to bat legally for businesses or schools that mandate vaccines?
Dr.
Well,
Fauci?
thanks, Jeff. Let me take the first part of that question. You really have to be careful when you ask for projected timelines, because the fact is the most prevailing issue involved here is that if we can get as many people vaccinated as we possibly can, as quickly and as efficiently we can, particularly in the context of the BLA now that has come out from Pfizer and the availability of other vaccines on EUA, we can end this as a pandemic even sooner than. So rather than focus on the situation of getting a specific timeline, I would like to appeal to this country, to the people in the country who are not vaccinated, to realize that we have the capability among ourselves to essentially cut down the time frame to getting the end of this pandemic very, very clearly by just listening to everything you've heard on this press conference. Get vaccinated, and the time frame will be truncated dramatically.
We don't take orders from you, chicken licker.
Question, in terms of vaccine requirements, I think we have a strong track record that shows that we're willing to pull lever after lever, and we'll continue to look for additional measures we can take to require vaccines. Over the past several weeks, we've imposed a series of new requirements. First, federal workers who must show proof of vaccination or undergo rigorous testing and masking. Second, the armed forces who require COVID-19 vaccinations now for all 2.1 million troops and National Guardsmen and women. Third, people who work in federal medical facilities, including the VA, Indian Health Services, and the Public Health Service Corps. And just last week, using the power of the federal government as a payer of healthcare costs, we're requiring nursing home workers to be vaccinated. We'll continue to look at every possible lever the federal government can pull, help curb this virus. And as to your question as to the private sector and public sector and not-for-profit leaders, we expect more and more vaccination requirements. They can help us end this pandemic. And we certainly have their backs, and the Justice Department has already said that vaccine requirements are indeed legal. Next question.
Let's go to Sarah Carlin Smith.
Hi, thanks for taking the question. You talked about the plan for boosters again today. I was curious if you could comment on why the White House is sort of getting in front of CDC and FDA here in terms of them actually reviewing applications and having data and, the necessary evidence to recommend boosters. Couldn't it create some public confusion if once the FDA and CDC do their work, it doesn't quite align with what the White House has been saying?
Well, good question. Thank you for that question. As our medical experts laid out last week, having reviewed the data, it was in their clinical judgment the time to lay out a plan for COVID-19 boosters. We announced our approach in order to stay ahead of this virus, give states and pharmacies time to plan. I mentioned the planning meetings that we had this morning with governors and pharmacy CEOs, and to give Americans time to prepare for their planned 8-month booster. So we've also made it very clear, starting last week, and we continue to reiterate, that our plan is pending the FDA conducting an independent evaluation and the CDC's panel of outside experts, the ACIP, issuing a booster dose recommendation or a booster recommendation. This virus has proven to be very unpredictable, and we've been planning for every scenario, and we want to make sure we stay ahead of the virus. Next question.
Jeff, can I just add one thing to that?
Please.
Yeah. So, Sarah, it's a great question. And one thing I want to emphasize, a key piece that went into this decision-making was the commitment to transparency. If you recall, we had been saying, myself, Dr. Fauci, Dr. Walensky, Dr. Collins, and other scientists and public health experts in the department, we've been saying for weeks that we are looking closely at the data to look for evidence that breakthroughs are increasing, any evidence that boosters may be needed. And if and when we see that, we will tell you. When we came together and looked at the data that finally gave us a sense that there was a signal or that it was important to act on, we wanted to tell the public as soon as possible because that was the commitment that we made. In no way does this actually bypass the integrity of the FDA and the CDC Advisory Committee processes. In fact, if you look at the letter that was signed and the statement that was put out from us, it is from not anybody else but the scientific experts in the department, from the Dr. Walensky, Dr. Fauci, myself, from Dr. Jana Woodcock, the head of the FDA, from the head of the NIH, Dr. Collins, and other medical professionals who drove this decision making. So we preserve integrity of process while still being transparent with the public, while still planning ahead and giving people a sense of what may come. And that's what we were doing with that announcement.
Thanks, Dr. Murthy. Next question.
Last question. Let's go to Aaron Billups at Spectrum News.
Hi, thanks so much for taking my question. Many parents are under the impression that young children do not spread the virus as effectively as adults, but there have recently been studies that challenge that. But as more and more schools are requiring vaccinations of everyone eligible, all staff, teachers, wondering if you could paint a picture for parents as to why their younger children should still need to be masked. What is the risk of young kids contracting the virus and spreading it to other people?
Dr. Walensky.
Yes, thank you for that question. I think our data have demonstrated that with Alpha, certainly, we saw less transmission in schools between children and between children and staff than we saw between staff to staff. It's not that there was none, it was that there was less. We also know now we're dealing with a much more transmissible virus. And we have, of course, seen outbreaks where children are transmitting to other children. So, and certainly with the Delta variant, that we know that transmissibility is increased somewhere around twofold. So the reason to mask in schools is not necessarily only to protect our adults, but also to protect our children from transmissibility from one child to another. And then, of course, from children going home to perhaps unvaccinated or immunocompromised or at-risk adults who might have waning immunity.
Wonderful. Well, thank you, everybody. We look forward to the next briefing.
What a bunch of trash bags. All right, give me a moment. All right. Supposedly, the press briefing with Jen Balsacki is supposed to start in 23 minutes. Usually, they're not that late. I'm not sure if Walter Biden's going to speak today or not. For everyone that wasn't here for the very beginning of the live, right before I went live, I received a text message from a reliable source. Basically, it's a very close friend of mine who knows that you can't say something to me and expect me not to tell all the hooligans. But he informed me that a mutual friend of ours, his wife works at a medical facility, a big hospital close by. I don't want to say where or what it is because I don't want to get them in trouble. But they are going to be in meetings all day today with DHS workers to talk about training on how they're going to start taking kids from parents who don't get the jab. Apparently that's supposed to start next week. They will start these investigations and start going after basically children here in Michigan. I don't know. I haven't been able to look into it. I've been live pretty much as soon as I found that out. Definitely look into it. See what's going on in your state. See what the medical personnel are going through where you live. We're not going to let that happen. That's a line we're not going to let them cross. Like, that's not going to be okay. But we've been waiting for them to cross the line one way or another. We know they're going to. I don't know if you heard the beginning of that briefing we just listened to, but they said the unjabbed are they're the enemy, basically. They're ready for wartime something or other to combat this resistance. They're very funny on how they word everything, but they're just basically blatantly saying that you will either do what we say or we will come for you. Last week they were saying that they're ready to deploy FEMA as well as the National Guard to combat C19 critical missions. But all they're saying that they're having an issue with is the people who won't get the jab. So it's kind of like they're blatantly saying they're ready to deploy FEMA and National Guard to deal with the people who won't get the jab, because those are the people that they're having an issue with. Because the jab's great for you, and people who get it, you're great. And if your kids get it, you're great. And if y'all wear masks and hide in your house and be as scared as you can, then you're great. But if not, well, we're ready to deal with you too. And they're just basically blatantly saying it. They're just funny on how they word it. Words. Not good. Stuff is not good. A lot of people already know what's up. I see all of you in the chat. I see people all over TikTok. I see people all over Facebook. Almost everywhere I go now, there ain't no scared people outside. I'll tell you that. People who are scared, they're probably scared to open their face at this point. People are very vocal right now that they've had enough. Like, enough is enough. People are losing their jobs. People aren't able to go to school. People aren't able to do anything without showing your papers to the Nazis. It's not good. It's not good. We'll see how this goes. I think I know how it's going to go, but I don't know why they want to push it. Maybe their perspective of Americans, everybody's gonna be docile and just take it, but that's not the Americans I see every day. People are done with it, so we'll see how it goes. I'm really interested to hear what Jen Balsecki has to say. Lately, she's been coming out with little co-signers and people who want to. It's like they can't shovel the lies enough. So they're like, come on, Jim Bob, I need you to come lie with me, because they don't believe me anymore because they keep catching me lying. So I'm going to bring a new face out, and then you start telling them lies, and maybe they'll believe you for a while. It's dumb. Debaholic. People have been talking about forging cards, and now it's like a felony. You get caught with a fake card, it's a felony. How does that even make sense? How does that even make sense? You have a falsified document that's a medical document about your own health that most people shouldn't even have access to without your permission, because it's a medical document, and they want to lock you up for it? Is that not scream information on its own? Is that not, like, obvious? I'm surprised conflict hasn't already started. I feel like it's any moment now. That's what it feels like to me anyways. And it could be because I watch this stuff all day, every day, and I'm up, front lines of it, but it's rough. It is rough stuff. Jojo, you don't have any sound? You can't hear me? I don't know. It seems like everybody else can hear me. I feel like it will be any moment now. They're going to do something across the line. I plan on calling the school. Probably not today. If I can't call the school, I'll have someone else call the local school and see what they plan on doing at the schools near me. And if they plan on doing any of this stuff, I will go interview them. I will go put them on camera. I am not scared to do that. I've already been in that school with cameras on me and stuff. I am not scared to go do that stuff. And people don't tell me what to do. Not at all. They see these vibes and they're like, sir, can you just lower your voice a little bit? Please don't talk so loud while you're screaming at us. I say what I mean, and I mean what I say, no matter where I go. Yeah, we're not going to tolerate this. No, we have rights. This is a free country, and it will remain that way, no matter what. From what I see, everybody feels that way. I can't wait to hear this nonsense. I wonder if they're going to talk about Afghanistan. It doesn't say. It just says press briefing by Secretary Jen Psaki. That's all it says. And then I don't know if they're going to do the speech with old man Walter Biden or not. At one point, it looked like they were rescheduling it, but now it's not on the list at all. It just says at 12 o'clock, which is 2.5 hours ago. So not sure if that's still going to happen or not. I mean, how many times they got to lie to us in a day, really? So we'll see how this goes. Let's get some shout outs in. Thank you so much, Mark Hill, and thank you so much, Gina, for your donations and your support. I really appreciate you guys, and thank you for being here. Let's read some of these other chats. Oh, and please take a second to hit that like button. Let's get these likes filled up. It brings more people into the chat. It tells the algorithm to put this live stream in front of new viewers, potentially people who either agree with us or they need their eyes opened up. Either way, we're here for them. Jeez, PMT, you be filling that chat up. I'm surprised there would be so many people watching on Rumble, but nobody chats. Somebody said when you chat, you have to leave the live. Rumble needs to like fix these bugs they got going on. Yeah, Brenda, I think that they don't think there will be a resistance. That's why they keep trying to say, oh, there's only 10% of the country who hasn't received the jab, because they want you to feel like the minority. Because if you were the minority, everyone would be against you. They would be able to snuff you out. They'd be able to tell you what to do. But according to what I'm seeing around me, I don't think we're the minority. And on top of that, people who take orders, people who love communism, people who are scared, people who are against the belief of irregularities, people who have to call you names during a debate, people who can't reason with you, people who can't find common ground or even have a discussion with you. These are people who are unarmed. These are people who are scared of guns. These are people who are scared of American rights. And these are people that don't have value, in my opinion, or a backbone to stand against anybody who was willing to resist. So even if they were the majority, let's put it like this. You jump in a ball pit. There's more ball pits than you, but who's in control? You were the ball pit. Let's put it like that. That's probably the most legal way I could say it. And fuck those people. Honestly, fuck those people. Hey, thank you so much, Donna, and thank you again, Mark. I really appreciate your guys' support. You guys are awesome. I appreciate all of you for being here. While we're sitting here during this break, waiting another 13 minutes for them to go live, please subscribe or follow to whatever platform you are currently watching. We go live every day on all these platforms, unless something is a little bit too spicy for YouTube. If it's spicy, I can't show it on YouTube and Facebook. So make sure you subscribe to an alternative platform as well. We are live on Twitch, Odyssey, and Rumble outside of Facebook and YouTube. So definitely subscribe and follow to stay up to date with what's going on. And join the Discord. The Discord is a free app you download on your phone. You can also use it on a PC or a computer of your choice. But you go to any of my live streams, even if they're not live anymore, no matter what platform we stream on, go into the description, find the link to my link tree, or if the description you're looking at has the direct link, Either or, you will be able to find the Discord, follow the few simple steps, and you will be greeted with an automated message letting you know that you've done all you need to do in order to receive notifications for when and where we go live. There is no algorithm on the Discord, so when I say we're live, you will get that notification unless you turn your notifications off. If you do that, there's nothing I can do to fix it. You got to fix it. But by default, your notification should be on for when you're tagged, and I tag everyone. So basically, when I say we're live, at this point, it's like 3,200 people should be receiving the notification. It's up to you whether you want to click the link or not, but you should be notified every time we go live. These platforms have algorithms. They do not notify everybody. They have some sort of formula they work with to show about 10% of your subscribers or followers notifications. The rest of them don't receive notifications unless the first 10%, a good amount of them, click it, which is also why I encourage all of you to hit like buttons and stuff like that. It's not for vanity. It's not because I'm begging you to like what we do here. It's because it tells the algorithm to bring more people into the chat and see what's really going on. So that's why it is important. Also, we have great conversation and constant information going on in the general chat on the Discord 24 hours a day. So if you would like to be speaking with like-minded individuals, be able to receive information as we find it, like a lot of information, not just about a single subject, but about things happening all across the world, from news articles to live interviews to videos and images and screenshots and everything. And it's not a bunch of Q crap. It is actual investigated information that all of us are researching 24 hours a day. If you would like to be a part of that, definitely join the Discord. You do not have to participate in the conversation. You can just use it as a notification platform, but either way, it is worthwhile. So thank you guys all for being here. Let me get this into full screen, and it should be about 10 more minutes or so before old Jen Bolasaki gets on the screen. So give me a moment. All right. We'll see if they're on time or not. Actually, I'm going to check the White House schedule again since it's changing so much. Yeah, it still says at noon today, which is 2 hours and 35 minutes ago, Old Man Walter was supposed to be delivering remarks on our ongoing efforts in Afghanistan to evacuate American citizens, SIV applicants and their families, and yada, 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 and his meeting with fellow G7 leaders. I don't know, maybe it was too many lies for them to write up before they had to go live today. I'm not sure how they do the schedule. Sometimes I'll wake up 6, 7 in the morning, get a water or whatever, and the White House schedule will not be up. It's like somewhere between 7 and 10 o'clock they decide to write this schedule. So I can only imagine when they decide to write the speeches for these lies. Also, for anyone that did not hear me say it earlier, I did and do have a scheduled march today. As far as I know, it's just going to be me and my friend, which is totally fine with me because I could care less if it's just us two. I assume people will join us. I think around here people are waiting for that first person to stand up. And if that's the case, I'll be that first person. We're going to go out there. We're going to march the main strip carrying American flags. I do intend on playing the national anthem. I have some testing I have to do because I don't know if the version of the national anthem that I have has already been copywritten on YouTube. I know that it's not like a legal copywritten thing, but if somebody does a distribution professionally, when YouTube receives it, they will put a content ID on it. And so if that version I have, which is the full version, like the 7-minute song with like all 3 verses and stuff like that, if it is copywritten, it will flag the live and it will take the live down. So I'm working on it. But it is a pro-American march. It's obviously not affiliated with any group, because I'm not affiliated with any group. It's just about being a proud American, loving your country, loving the Constitution, and not being afraid to go out and tell everybody that. So I do plan on doing a march today. It was supposed to be around now, but my friend is working overtime, and where he works, you don't know that you're working overtime until you walk in the morning. So he has to work until they achieve a certain objective. When they do, he'll get out. The march probably will not be as long as it was originally intended. We were intending to go to 3 different locations and march the entire main strip of those areas. Now we may just go to the biggest area and march the strip. I don't want to disclose the location at this time, because if there is enemies watching who think they're going to come do something funny to us, I don't want to cause conflict, and we will not be the ones going down if there is a conflict. So please, if you're watching this and you have ill thoughts, please keep your ass at home, because otherwise you will never go home again. I promise to God. We do not want conflict, but we're not willing to go down for our rights either. So with that being said, at some point in time today, I will be going live in person outside of my home for either the march or at least a test. I have to test this. I've never gone live from my phone. I do have some equipment I put together. I do not have a gimbal. I tried to get a gimbal. They don't sell them in my area. They're very expensive. I probably will have to order one. So it may be a little shaky, but I'll do the best I can. It's going to be my first live from my phone. Expect there to be technical errors and stuff like that, but I'm going to do my best to make it a smooth ride. And this will be my first public, whatever you would like to call this, demonstration, I guess. And we'll just see how it goes. It's not about causing issues or anything like that. It's just simply telling the world that me and my buddy, we love America. We love our Constitution, and we assume we will find other like-minded individuals who will probably want to join us in the march, which is totally fine with me. We're gonna march because I'm worried that if we were to find a location to stand, like a lot of flag waves that we watch, we will run into issues, whether it's with police officers, some sort of elected officials, or people who decide that this is their opportunity to play Call of Duty, or this is their opportunity to start a counter protest to what we're doing. And like I said, I am not inviting conflict of any sort. So for us to march down public sidewalks, there's nothing they can do to us. There's nothing that they should even try to do with us. So yeah, expect that later today. Like I said, it was supposed to start around this time, but due to life, the way life goes, make a plan and make a plan for the plan to fail. At some point in time, we will be doing that. Big Cat, I don't know if you're saying something goofy to me, because we don't drink Kool-Aid over here, son. But we will be hydrated. I do have bottles of water and hats and sunscreen and stuff. Although I look really light-skinned on the camera, I'm a somewhat percentage of Italian. This tan does try to protect me a little bit, but that sun cooks me. I do not do well in the heat, but it's worthwhile. And it's a hot day today, but I don't care. I've been looking forward to it for like a week now, to go do this march. And if my friend doesn't get out of work, I'll be out there marching by myself. I wish I had a plate carrier, but it is what it is. I wish I knew if your name was Emily or Emile. Your Rumble went down. Let me see if it went down on my end. Maybe I said too much. Oh, Lindsay, I won't be alone. I'll have all the hooligans with me on the live stream. I'm not scared. Hey, I appreciate you, Sarah. Thank you for your support. William, The weather's looking rough. I mean, as long as it's not thunderstorming. I don't want to go out there and thunderstorm and get struck by lightning because I'm carrying a steel pole. I mean, that'd be really stupid of me. But anything outside of that, I'm not worried about it. Heaven Mag, yes, White House staff sucks. Their scheduling staff sucks. The people who write their speeches suck. The people who control their audio sucks. The people who hold the cameras and choose the angles suck. The people who clear what questions can and can't be asked suck. It's dumb. It's so dumb. Jeb says you cannot watch the stream while you are typing in the chat on Rumble. Okay. I had heard someone else mention that. I wasn't sure. I haven't watched anything on Rumble, so I'm not exactly sure what it's like to be on that side of the fence watching Rumble. Hopefully they fix that. PMT, you can't hear me on YouTube? You guys can hear me on YouTube, right? Press 1 if you can hear me. I've had 3 or 4 people now tell me that they can't hear me. Also, if you guys are a part of the Discord, there's a new art tab that I've created. One of our hooligans, well, actually a few of our hooligans create graphics and do different art and stuff. And I wanted to give them a place to be able to, show off what they do. And somebody has created a graphic of Jen Balsacki that is hilarious, but I don't think I could get away with showing it on the live without triggering something. So if you are a part of the Discord, if you're not a part of the Discord, you should be a part of the Discord. But if you are a part of the Discord, you definitely should go check it out because it's hilarious. It's a depiction of Jen Balsacki in all her glory. I love when people tell me to unmute stuff. If only you could see the screen I'm looking at. I'm looking at 13 tabs, 2 different screens, 2 different monitors, and a whole platform of audio signals and information, as well as the automated list letting me know everyone that subscribes, follows, likes, donates, or joins the membership program. So yeah, I'll just go and unmute it. Cracks me up. Thanks, guys, for the feedback. I'm glad you can hear me. Yeah, it's like being in front of the command center. Definitely. It's interesting how this all developed. It just started with a GoPro being kind of bootleg hooked into my camera, and a microphone I've had maybe 15 years that I use for recording vocals and stuff. And just old computer equipment and stuff I've had laying around the house because I like building computers and stuff. And then one day the riots kicked off, and been doing this ever since. So it's so crazy how this has all gone. My documentary is gonna be awesome. I tell my friends that all the time. It's gonna be awesome. I can't wait for it to come out. It's not gonna come out until someone offs me, unfortunately, but it's gonna be awesome. We're gonna put all the information in it. Hushai Ashley Babbitt, that's going to be in there. Kyle's going to be in there. George Floyd's going to be in there. Courtroom hearings, irregularities, everything it had to do with COVID. Oh, I shouldn't have said it. Now they're going to take the video down. Yep. It's going to be awesome. Come on, Jen Balsacki, you're 2 minutes late already. Good Lord, these people at the White House, they really do whatever they want. Son, when you go to the Discord, there should be a drop down menu here. Let me be really accurate here. So when you go into the Discord, You should see welcome page, rules, Jeff Mack links, announcement board, general chat. And below that, you will see going live related chats with a drop down for a bunch of different, more specific chats. Below that, you will see specific subject chats. The very bottom of that list, well, I guess one up from the bottom of the list, you will see art. And you will see great depictions. Oh, I guess they've dropped in a new depiction for Hunter. So we have Jen Balsacki and we have Hunter Biden, as well as some pretty awesome graphics in there besides that. But you guys should definitely check that out. Thank you so much, Sleuthy TV, for your donation and your support, and thanks for giving me that feedback. Yeah, when I went on Rumble with the app on my phone, I could not see the chat. When I'm live, I'm watching it on the browser, and it's actually got the chat right next to the window. So I wasn't sure how that worked. But I've also noticed when I go live through Rumble, people comment in the comment sections thinking it is the chat. I mean, people do it on YouTube also, but not very often. But on Rumble, sometimes I'll get 30 comments like, oh, I agree, or that's BS, but nobody knows what they're talking about because they're commenting during the live video instead of being in the chat. These platforms should really work on making things smoother. It's kind of weird. There's like an ongoing debate about, hold on, Jersey Devil, I'll get you the link, whether or not the FDA has approved the jab. I'm going to look it up. I'm pretty sure it's approved. I don't want to sit here and debate people, but I see people debating it in the chat. I also heard and kind of read that the information that was given to the FDA is by the NIH, and the head of the NIH is the wife of Fauci. So that's pretty convenient. That's pretty convenient. I will have to look into it more. I've had a lot of people kind of confirm that, but I have not confirmed it on my own. But I'm going to look up this FDA thing because I'm seeing articles and all that stuff saying it is. Like Fox News and all of them, they're saying it is totally approved. And then, see, now I got people in the chat saying it's not approved. I'm going to look it up and see what they say. I probably won't be able to put it on the screen. But we're sitting here anyways, waiting on Jen Balsacki, so why not? According to the FDA website, it is approved. It doesn't say, oh, we extended this, that, and the other, whatever. It says just flat out that it is approved. I would read it, but there's so many words in there that I can't say on YouTube. I'm going to slip up and get my whole channel taken down just to split hairs here. Pretty sure it's just approved. Dylan Bloomfield Art. That is the creator of those depictions I just told you guys to check out in the Discord. He does very awesome work. Appreciate you, Dylan. That sucks, walking truth. I've read and heard that story so many times. People going and getting the jab and having reactions almost immediately. And they say that you will receive reactions. Sometimes people get the flu shot and then they get like a cold immediately. but like real reactions, life-changing reactions, and that's unfortunate. All right, everybody's telling me to go read page 13. I don't know what you guys are reading. Okay, I'm reading like the front page of the FDA. There is no page 13. I'll have to download the document and look into it more. Or if there's any hooligans in the Discord and stuff, go and screenshot page 13 for me and tag me so I can read it when I'm not live. Okay, so they pushed the press briefing with Jen Balsacki to 3:30, which is in 40 minutes. And then at 4:30, which is an hour later, old man Walter Biden is supposed to, again, make an attempt to come and speak to all of us, or, you know, just lie and stammer and blink in front of us. This is going to turn into an all-day thing. Maybe they know that I'm trying to do a march and they're preventing it because of my dedication to getting the truth out. These idiots. All right, what I think we'll do is I think we'll shut this live down for the archive. That way I don't have to change the title again. In about 30 minutes or so, we'll go live again with Jen Balsacki and whatever she has to say. And depending on how long that is, we may either just continue on into Old Man Walter speaking, or, you know, we will shut that down and then go live again. We'll see how it goes. But they're really affecting my my march here. I'm not going to worry about it until my friend gets out of work. When he gets out of work, if Old Man Walter ain't spoke yet, I'm not going to worry about it. All right, so we're going to actually just give me a moment. All right, so we're going to wrap this up. We will be live again in about 30 minutes with Jen Balsacki and the lies that she has to tell us today. Thank you guys for being here. I really appreciate you. Big shout out to everyone that made donations, joined the membership program, or purchased any merch. I would not be able to do this without you. You guys keep the show going. Thank you so much. Please make sure that you subscribe or follow or do whatever you have to do in order to be connected to the platform that you are currently watching this on. We go live every single day, so please stay connected. Join the Discord. As long as you watch the Discord, you will never miss a notification for when and where we go live. Do not rely on the platforms to send you a notification, and do not write comments under my videos saying, oh, I didn't receive a notification, because every single time people do, I write join the Discord and I provide the link. This is your message right now. Join the Discord. Don't tell me you didn't get a notification. I have given you solutions. I'm sorry if you don't receive a notification. I'm sorry that you don't take the time to join the Discord. I don't know what else to say. I'm not trying to be an asshole, but come on now. I can't hold your hand through this. You're either with it or you're not. I appreciate you guys being here, but I can't do any more than I am. I've provided everything I can. Okay, you gotta roll with the punches here. I appreciate all of you hooligans. God bless all of us. Thank you guys for watching. I will see you on the next live in about 30 minutes. And until then, stand tall, shine bright, and that's a wrap.